So I've got my patient Mia with me today, who's a 51-year-old lady who's never had filler treatment before. She has had some toxin treatment to the upper face. Her reason for coming today was a concern about predominantly lower face laxity and loss of volume in the mid face. So what we're going to do first of all is look at how to do a proper facial assessment. What we want to do is have a systematic approach to facial assessments. So if we divide the face into thirds, with the upper third, the mid third being from the eye to the mouth, to the top of the nose, and the lower third from the nose to the chin, we can look at each point in turn. Now, at rest, looking at the upper third, you can see actually there's no static lines across the forehead or in the glabella. There's a few softer static lines around the eyes, and this is perhaps attributed to the fact she has had toxin treatment. But in the upper third, she's got some ptosis or drop of the lateral brow. She's got some laxity of the skin on the upper eyelids, and equally some loss of volume in the temples here. The mid face, she's got some good volume across the mid face, and if we ask Mia to smile, you can see on active movement this lifts the anterior cheek up nicely, but where she's perhaps lost volume is laterally in the cheeks, and with descent both coming forward creating some heaviness at the top of the fold and down creating heaviness of the lower face here. So the lower face, she hasn't got a crease along the length of the nasolabial third, but perhaps some loss of volume and heaviness at NL1 at the top of the fold. She's got the start of some perioral lines across the top lip. Could you just pout for us, Mia? Accentuated on pouting there. And she has got some heaviness across the jawline, the jowl area, with some dimpling of the mentalis muscle here. So our plan of treatment, if just using filler today, will be predominantly to focus on the mid face and lifting points, although we will also look at the temples, and then looking at defining and straightening the jawline in order to minimise the appearance of the laxity across the jaw. What I would then plan to do at a later point is perhaps bring her back and look at how we might soften around the lip area, which could either be using toxin when she's next due upper face toxin across the perioral muscle and the orbicularis oris to soften the lines, or look at a subtle lip filler treatment to help define the lip and soften the lines that way.